Newborn babies, they poo a lot. They can poo like 6 times in a day, no jokes. That's totally normal. There's nothing wrong with that. That's just the way their digestive system works at that time. What's up, beautiful people? Welcome to another exciting episode of Laboring with Your Pregnancy Partner, Dr. O. You already know, and I'm sure you can tell that I'm pretty much excited today. Let's go to the important people of the day, the people that own this show, the babies. And this is where a lot of moms always get confused. What do I pack in my hospital bag for my baby, especially if you're a first-time mom? So let's go over the items one by one. This baby shopping is not done yet, so I don't have all the items in my bag, but I have most of them. For your baby, you want to have clothes, of course, so you need to have onesies in your bag. Okay, every baby wears this, no matter their age, and they come in different sizes: newborn, 0 to 3 months, 3 to 6 months, and all that. So you want to be getting, so when you're shopping for your baby, I'm going to talk about this more in my shopping for your baby video, but you want to be shopping different sizes, right? You don't want to get too much newborn sizes, because some babies even come out and they're already bigger than newborn size. So imagine if you bought all newborn size, that means you have wasted your money. Trust me, you don't want to do that. So just get a few newborn sizes and get more of 0 to 3 month sizes when you're buying clothes for your baby. So you need to have onesies for your baby, and of course you need to have matching socks to go with them. Okay, for onesies and socks, pack at least let's say 6 to 8, okay, because you don't know how long you're going to be staying in the hospital. It might be an average of 2 days stay, 3 days stay. You can't really tell. And babies, they tend to have they tend to need to change their clothes often for hygienic reasons, and because, well, different people have been carrying them. Breast milk could spill on them, formula milk could spill on them, so you just want to have extra clothes, right? You don't want to be going back home because of baby clothes. So you have your socks, and then of course your inner wear. So depending on where you're giving birth, right? If it's a cold climate, you want to make sure that your baby is as warm as possible. If it's a warm climate, you might not bother too much about this, okay, but that just depends. It totally depends on you. And then you want to have the receiving blankets. We haven't bought that, we're still going to do that in our shopping next week. But you want to have receiving blankets for, you know, carrying your baby, keeping your baby warm, swaddling your baby, covering your baby when your baby is asleep. You want to have the towel for when your baby is, when they shower for your baby, right? And this is usually what the baby's towels look like. They have this hooded part at the top for you to put on the baby's head while you wrap the baby around in the rest of the towel. So you might want to get one of these and not the regular towels. Then of course you need diapers, the almighty diapers. Now for these diapers, make sure you budget at least 6 diapers per day, because babies, newborn babies, they poo a lot. They can poo like 6 times in a day, no jokes. And then if you find that your baby is pooing 6 to 8 times in a day, that's totally normal. There's nothing wrong with that, right? Some babies, as they're taking milk, they're pooing it out, they're taking their poo, and that's just the way their digestive system works at that time. So take at least 6 to 8 diapers, so you won't be shocked and you'll not be angry that your baby is pooping. And of course, if you're going to use diapers, getting wipes is a good idea. Baby wipes. You need baby wipes to be able to wipe down your baby when your baby uses the toilet. Make sure you get nice absorbent wipes that are good. You want to have regular toiletries, your baby lotion, your baby oil for your baby's hair, very important. Then your baby's soap or your baby's body wash. Then you want to have washcloths. Washcloths, they are used to, you know, bathe for the baby. We normally like soft, absorbent ones, not anyone that is too harsh. Don't use any harsh sponge on baby's skin. The baby's skin is still very delicate at that time. So you just want to use stuff that are soft like this one. Of course, your baby's comb and brush for grooming of the baby, combing the hair, brushing the hair. Then you want to have these BURP cloths, right, for clean, because newborn babies, they tend to spit up a lot. You just be sitting there carrying your baby, and next thing you just see milk all over your face. Yeah, that happens a lot. I'm sure you've seen it in movies or on social media and stuff like that. It's not a joke, it actually really happens. So you want to have BURP cloths to like clean them, you know, wipe them down after feeding them, and if a spit up should happen. Can someone guess what this is? I'm sure if you're Nigerian, you're familiar with this. Okay, we use this for deliverance. Okay, that's me just being silly. So this is olive oil, or An alternative to this is coconut oil, and this is actually not necessary in all countries, but if you live in Nigeria, you know that all hospitals require you to bring this when you're having your baby. This is because they use olive oil. When your baby is just born, your baby has something called vermis that is all over the baby's skin, this whitish substance on the baby's skin. Olive oil or coconut oil is what the midwives use to wipe this off the baby's skin. Okay, it usually helps to easily wipe this off and make your baby look nice and clean before they hand your baby over to you. So if you show up at the hospital without this and you're giving birth in Nigeria, they're going to be so mad at you. So make sure you come with this, or coconut oil. Some tend to prefer coconut oil because it has a different consistency and it's usually lighter. So it's up to you what works for you, what you can afford and all that. Another thing you want to have is diaper rash cream for your baby, right? Because some babies tend to have sensitive skin, and if, for example, because you're a new mom, you might, or yeah, even if you're a veteran mom and you have not given birth in a while, you might have forgotten how frequent you need to change the diapers of your baby, right? So what diaper rash cream does is, like, it serves as a barrier between the skin and the diaper and whatever poo or mess that is in that diaper. So it protects the skin. And some of them are actually treat diaper rash as well. They don't only protect the skin, they treat diaper rash. Some people wonder that, do I have to use diaper rash cream when my baby doesn't have diaper rash? So you don't have to wait until your baby has diaper rash to use diaper rash cream. You can put it just to act as a barrier between the skin and the diaper or whatever mess that is on the baby's diaper, right? Another thing you want to have in your baby hat is this mittens, right? I'm going to put the picture up here because our shopping is not done. I don't have that with me, unfortunately. It's keep their hands warm, and also for babies that tend to sort of scratch their face a lot, right? Mittens prevent them from scratching their face, and for those that put their hand in their mouth, you know. Another thing it does that is off label is it prevents people from direct contacts with your baby's hand. So when they're shaking the mittens, you can be changing it. When they go, you just change the mitten and put a new one. So yeah, kind of like reducing your baby's exposure to different bacteria and stuff like that. So that's another hidden treasure of those mittens. So in case you're wondering why people actually use them. Another important item you need to have is baby hats. I cannot overemphasize the importance, you know, because babies are coming from a warm environment. They're not used to AC, they're not used to cold, they're not used to harmattan or winter, or whatever your weather condition might be. They like warm, cozy environments because that's where they're coming from, right? Because the womb is really warm and cozy. So you need to keep their head covered, at least for the first few weeks after they are born, to keep them warm. Because if you notice, for those veteran moms, anytime you take off your baby's hat, before long, your baby will start sneezing and sneezing and sneezing. One sign that your baby might be cold is if your baby starts sneezing, right? If your baby starts to sneeze, then you know that you're probably exposing your baby a little too much. So you might want to put the hat on, wrap him or her up in a blanket to keep him as warm as possible. Another one that you should have for moms that have chosen not to breastfeed is bottles, feeding bottles. You need to remember to pack feeding bottles, at least 2 or 3 in your hospital bag, and infant formula, very important. So as time goes on, like I said, you know the formula that works best for you and your baby after you try out 1 or 2, right? But whenever you find one that works, just stick to it. No need brand shopping up and down when you found one that works for you. Even if you're a mom that has chosen to breastfeed, it's very important that you also have 1 or 2 feeding bottles and formula, just because veteran moms can bear me witness, whenever you just give birth, your milk might not come just yet. And of course, you're not going to keep your baby starving just because your breast has refused to produce milk immediately, right? So hospitals will recommend that at that point, you give your baby infant formula, pending when your milk starts to flow. Don't get discouraged if your milk doesn't come out on time, right? Because the more the baby sucks, the more the milk will come. So basically, the sucking reflex stimulates the production of milk. So encourage your baby to suck, even if your baby is sucking nothing, your baby is sucking air, your baby is just sucking ordinary breast with no milk. Let your baby continue to suck. The more your baby sucks, the more it will stimulate your body to produce milk, and eventually the milk will come out, and both you and the baby will be happy. So like I said, even if you are breastfeeding, always come with feeding bottles, just in case your baby has to take formula while we wait for you to start lactating. You need to have really cute outfits for the baby to go home with. Yeah, baby should not go home in onesies. The onesies are pretty boring. You know, there are going to be a lot of people waiting at home to receive you. So get some really cool, nice clothes for your baby, you know, let baby look good. If possible, even get some nice baby shoes for the baby to wear, just for the effigy, for the pictures, for the paparazzi, okay? Very important. Depending on the country where you live, some hospitals will not allow you to step out without a car seat. So make sure you put it in your budget because it could be pretty expensive. Make sure that the car seat price, you budgeted it and you bring it to the hospital with you when you are coming, so that when you are leaving your hospital, you go home in peace. Because without that car seat, some hospitals won't let you go home. And even for countries where they don't insist on using car seats, it's always advisable. It's your newborn baby. Anything could happen on the way. Slightest accidents could affect the baby the most because they are the lightest, right? So in case your car stops suddenly or something and people like jerk forward, baby can likely fly out of your hand, and just imagine the kind of disaster. Trust me, you don't even want to imagine. I mean, your baby's life is worth more than anything, right? So just get the car seat, put your baby inside, and on your way home, have a smooth journey, have a smooth ride back home. That's about all the items I have for you. My hospital bag is in a mess now. I'm going to need to tidy it up, you guys. So I said I was going to talk about the ozone community later. So ozone community, if you're a subscriber on this channel, you're following me on Instagram, you're on our community on Facebook, then you are definitely already a member of the ozone community. Congratulations. It's our support group where pregnant moms, everybody generally, not just pregnant moms, just comes and finds people with like minds, you know, talks about maybe pregnancy together, whatever health condition it is. You always have somebody to put you through, to support you. There's always people to ask questions. I'm always there to answer your questions. And like I said, I'm going to reply to every DM you send me. I'm going to reply to all your comments. So please feel free to keep them coming. Until then again, I'll see you next week. But like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.